Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Sophia, who was pregnant with her second child. Her first pregnancy and labor was reported by her as easy with no complications. Her daughter was born in the hospital, and Sophia had an epidural for pain management. The week before Sophia's due date, she asked for a stretch and sweep to see if we could get things going, as she had a wedding coming up and she really wanted to attend it. After a discussion on the risks and benefits of a stretch and sweep, Sophia still wanted one, and so we proceeded. Her cervix was 4 centimeters dilated, but it was thick and firm, so I was not able to stretch it out at all, and explained how intercourse with ejaculation might be your best option at this point if she was comfortable with that. Well, the day before Sophia's due date, she paged back saying she wanted this baby born, and what else could she do? One of the things we discussed in detail was taking castor oil, but it comes with some risks. Sophia decided she was okay with the risks and drank the castor oil. After 2 tablespoons of oil and 2 hours of nothing, she paged me back to let me know. I explained again that the dose is 2 ounces of castor oil, not 2 tablespoons, so Sophia would try again, and paged back 3 hours later, asking me to come to her home where she was planning to have this baby. I called my planned backup midwife to let her know I might need her soon. Kristen was doing home visits in the community and was ready to come when needed. When I got to Sophia's home, she was sitting on a big ball and her head was hanging down as she was working through a contraction. Dad had just cleaned the kitchen, which still had the delicious aroma of ribs lingering, and their daughter was curiously watching Mom's new behavior. Grandma was 10 minutes away and on her way to pick up her granddaughter for a sleepover. It was clear to me things were happening, so I quickly listened to the baby and then started to get my equipment from my vehicle. Sophia was contracting every 4 to 5 minutes and was preoccupied with getting her daughter out the door, so it was about 20 minutes before I could check how dilated she was. But when I did check Sophia's cervix, she was 5 to 6 centimeters dilated, and the cervix was very thin. The baby's head was snugly against the cervix, and the bag of water was intact. It was tight over the baby's head. I informed my colleague, who says she'll finish her home visit and make her way to the house in about 30 minutes. Sophia is back bouncing on the ball. Her cheeks are flushed, and she's not talking anymore. Only 10 minutes later, Sophia says, "Uh-oh, something happened." I looked up from my paperwork to see her standing. "My water broke." I checked the baby's heart, which we always do as soon as the water breaks, and it's normal. Then I call my backup midwife to come now. Sophia wants a water birth, so Dad starts filling the bathtub. She has reached a new level in this labor, making very loud groans. Clear fluid drains, and we see lots of bloody show as she walks to the bathroom. I texted my backup midwife to say, "Things are happening quickly," and she replies, she's 10 minutes away. I finalize my equipment setup as Sophia climbs into the tub. She leans over the side of the tub, making sounds her husband has never heard her make before. Sophia says, "I can't do this," and he replies, "Then don't." I know exactly what those words mean and run to get gloves. As I run back to the bathroom, Sophia says, "The baby's coming." Sophia is still leaning over the side of the tub, facing her husband, who's sitting on the toilet. I look behind her and see a big gush of fluid, and then the baby's upside down in the water. I toss my gloves aside and reach down into the water and pick up the baby and say out loud, "Well, baby, you know how to make a grand entrance, don't you, little one?" Sophia is in shock, complaining about the pain in her vagina. Dad's eyes are looking in complete disbelief. I calmly say, "Sophia, lie back in the tub so you can rest and hold your baby," who is now becoming quite pink and alert. Within 5 minutes of the birth, the baby is suckling at the breast. Sophia suddenly gets a strong contraction and pushes out the placenta. We pull the plug on the tub, and Dad carries the baby to the living room, where the fireplace is filling the room with a wonderful heat as Mum gets settled on the sofa. Soon the house is filled with family. Even Big Sister is back, ready to fulfill her role. Thank you for joining me for another episode of The Birth Portal.